Before you leave the hospital, it's important for you and your caregivers to consider ways to return home safely and continue with your recovery. Meet with the hospital pharmacist to review your medications, as they may have changed while you were in hospital. If a dietitian was involved during your stay, they will review your nutritional care plan prior to going home. Book an appointment with your family doctor within 1 to 2 weeks after leaving the hospital. They will prescribe your medications moving forward and monitor your health and any risk factors related to stroke, such as your blood pressure. A report should be sent to your family doctor explaining your care while in hospital. If they didn't receive it, have your doctor contact the medical records department at the hospital where you stayed. If you don't have a family doctor, please talk to a hospital team member, such as your social worker, to help you find one. You may also have an appointment at a stroke prevention clinic. A neurologist and nurse or other healthcare professional may see you there. They will review what you need to do to prevent another stroke and discuss if any further tests or services are needed. Keep learning about ways to reduce your risk of having a stroke and how to continue with your recovery. Consider visiting the patient library at your hospital and asking staff for educational material available on stroke, such as handouts or online websites. Review your guide for stroke recovery, or visit websites such as the Heart and Stroke Foundation and the Toronto Stroke Networks. Ask your healthcare team about options to buy or rent equipment you may need, such as a walker or equipment for your bathroom. Sometimes, equipment is needed only for a short period of time, but can make a big difference in returning home safely. When you leave the hospital, you will be moving on to the next step of your recovery. This may include programs such as outpatient therapy, where you live at home but travel to a rehabilitation center for more therapy. You may attend a community exercise program and continue to work on physical recovery and learn more about stroke and healthy lifestyle choices. Other community programs can also focus on your social, recreational, communication, or thinking skill recovery. You may want to explore new interests or practice your communication skills in a group setting. Whether you're a patient or a caregiver, it may be helpful to talk with others who have had a stroke, as it gives you a chance to learn from each other and share experiences. Consider joining a support group in your community. Your healthcare providers can give you a list of local programs that are focused on your interests and needs. Ask your team about transportation services to get you where you need to go, especially if you don't drive or are not able to drive. Getting back to the community is the next step in your recovery, and your healthcare team is available to make this process as easy as possible. Therapy does not end in the hospital, and it's important that you continue with your exercises and programs moving forward. So once you go home, how might you fit these activities into your new daily routine? Remember, ask your team about resources out there to help you with your recovery. Managing your own health and keeping open communication with your healthcare team and those caring for you is the best way to live well and recover after a stroke. Thank you for watching our stroke education series. If you found the videos helpful, please share them with others.